How many thoracic vertebrae are present in the human spine? A. 7. B. 12. C. 5. D. 10. Answer: B. 12. What feature is unique to thoracic vertebrae? A. Transverse foramina. B. Costal facets. C. Large vertebral body. D. Bifid spinous processes. Answer: B. Costal facets. Which thoracic vertebra is known as the transitional vertebra between thoracic and lumbar regions? A. T10. B. T11. C. T12. D. T9. Answer: C. T12. The thoracic vertebrae contribute to which natural curvature of the spine? A. Cervical lordosis. B. Thoracic kyphosis. C. Lumbar lordosis. D. Sacral kyphosis. Answer: B. Thoracic kyphosis. Which part of the thoracic vertebra articulates with the rib tubercle? A. Vertebral body. B. Spinous process. C. Transverse process. D. Pedicle. Answer: C. Transverse process. What is the orientation of the articular facets in thoracic vertebrae? A. Horizontally. B. Coronally. C. Sagittally. D. Obliquely. Answer: B. Coronally. Which thoracic vertebra has a complete costal facet on its body for articulation with a rib? A. T1. B. T2. C. T10. D. T12. Answer: A. T1. Which thoracic vertebra lacks a costal facet on its transverse process? A. T9. B. T10. C. T11. D. T12. Answer: C. T11. The spinous processes of thoracic vertebrae are characterized by which of the following? A. They are short and bifid. B. They are long and directed inferiorly. C. They are horizontal and blunt. D. They are fused into a single ridge. Answer: B. They are long and directed inferiorly. The vertebral foramen of thoracic vertebrae is A. Triangular. B. Circular. C. Oval. D. Irregular. Answer: B. Circular. Which thoracic vertebra is most commonly associated with a compression fracture? A. T7. B. T10. C. T12. D. T5. Answer: C. T12. What is the function of the demifacets on thoracic vertebral bodies? A. Attachment of spinal ligaments. B. Passage of spinal nerves. C. Articulation with the head of ribs. D. Stabilization of intervertebral joints. Answer: C. Articulation with the head of ribs. Which ligament connects the heads of the ribs to the thoracic vertebral bodies? A. Costotransverse ligament. B. Radiate ligament. C. Supraspinous ligament. D. Ligamentum flavum. Answer: B. Radiate ligament. Which thoracic vertebra has only one complete costal facet on each side? A. T10. B. T11. C. T12. D. All of the above. Answer: D. All of the above. The thoracic vertebrae with the smallest vertebral bodies are located: A. T1, T4. B. T5, T8. C. T9, T12. D. T1 only. Answer: A. T1, T4. What type of joint is formed between the thoracic vertebrae and the ribs? A. Synovial joint. B. Fibrous joint. C. Cartilaginous joint. D. Symphysis. Answer: A. Synovial joint. Which thoracic vertebra is the first to articulate only with a single rib on each side? A. T9. B. T10. C. T11. D. T12. Answer: B. T10. What is the primary movement permitted by thoracic vertebrae? A. Flexion. B. Extension. C. Rotation. D. Lateral flexion. Answer: C. Rotation. Which ligament is located on the anterior aspect of the thoracic vertebral bodies? A. Posterior longitudinal ligament. B. Anterior longitudinal ligament. C. Supraspinous ligament. D. Interspinous ligament. Answer: B. Anterior longitudinal ligament. The thoracic vertebra with the longest spinous process is A. T1. B. T7. C. T8. D. T12. Answer: B. T7.